So in the last video, I talked about sitting bones, feeling the seat, right? So now we move our attention lower, we feel the floor, right? So we feel the floor with our feet, right? You could sit there and do nothing and try to establish a sense, where's the weight distribution in the feet? Is it more in the front? Is it more in the back? Is it more on the outside? Is it more on the inside? But let's explore the feet through movement, right? So what I'm going to do is just simply tilt forward and backwards. Ideally, you're going to be able to do this from the hip joint. Most of the people I see in the clinic are going to be a little sloppy with the movement, so they might do a little bit in the hip, and then they start to kind of flex somewhere in the spine. So they might flex a little in the lower, or it might be the middle, right? It might be a combination of everything. But let's see if we can get it a little cleaner so that you feel movement comes from the hip joint, right? And you could just imagine that your spine is this nice, it's this nice flexible tube that for the time being you're more or less keeping straight, right? So you come forward, right? So as you come forward, what you feel is more weight going into your feet, right? You also notice in the abdominals and the hip flexor region, it becomes softer, right? So your breathing actually would become easier. Now tilt backwards and feel that your feet start to get lighter, right? That's because your hip flexor muscles are starting to contract and they're starting to lift up the legs, right? So when you come forward, you feel the hip flexors relax and you feel that weight in the legs. Now bring your attention to your sitting bones and just feel that indeed you are moving on your sitting bones. And as you tilt forward, your sitting bones are moving apart. And as you tilt backwards, your sitting bones are moving together just a little bit. We're talking millimeters, maybe a centimeter, right? But there is movement of an opening and closing of the space between the sitting bones, which is known as your pelvic floor. So tilt forward and just feel comfortable with the weight in your legs, right? So it's like your feet are on two scales. Maybe it feels like you got 30 or 40 pounds of pressure in each foot. And then as you come back, use your sitting bones and feel that you could maintain some of that weight in the scales, right? So you can actually learn to sit more upright, or you can sit back. You can sit with your legs crossed, and you can figure out how to keep your legs and your hip and core musculature more relaxed, right? Which means that you'll feel the weight is in the legs, right? So that unnecessary tension essentially means that you're starting to use your bones, right? You're using your skeleton to provide support. So less strain for the musculature, for the joints, more comfort, right? So it's easier to sit for a longer time.